This will soon become a familiar scene for you and your family. A stay in a unit of the VCU Medical Center's critical care hospital can be a life-changing experience. This experience, seeing someone you love critically ill and attached to a lot of technology, may at first be quite a shock. That's understandable. But what you see here are the tools that can sustain life and bring some comfort from pain. And they are being operated by a highly trained and extremely devoted team of nurses, doctors, physical therapists, respiratory therapists, and other healthcare professionals working together to ensure your loved one can be comforted and ultimately healed to the best of his or her potential.
How's that? We actually program, all of the pumps have every medication that we use. And so we go in, we find the exact medication, we put in the concentration that's up here on the bag given to us by pharmacy, and then we're able to run it at a rate that, that the pump kind of guides us with and pharmacy sets.
Each one of these devices is programmed to ensure a critical care patient is given the prescribed amount of medication, nutrition, fluids, and oxygen to ensure stability while healing.
All of the IV drugs are reviewed by pharmacy and the doctors every day as to see if it's something that they need to continue, is it something that we can maybe, as in the case of the blood pressure medication, is it something that we can bring down every day, or is it something that needs to go up based on the patient's presentation? And then the nutrition, again, is reviewed every day, and if the patient is able to eat, then we're able to take this nutrition down and give him some tube feeding or allow him to eat just regularly.
Doctors and nurses can monitor their patients at workstations scattered throughout the floor. Even if a patient is alone for just a few minutes, there is never a moment where their vital signs are unknown.
This is Jennifer, may I help you?
And all nurses carry special phones that work on an internal communication system, so they are never out of reach. Alarms from patients' rooms and call bells ring to this phone. After the visual shock of seeing a patient in critical care, it is also understandable that all the sounds that fill the room or the hallways may be cause for anxiety. Fear not, many of the alarms you hear are only reminders.
When the infusion's finished, it'll just kind of beep once and then it'll continuously beep until you come in here. And if it's something bothersome, the patient or the family member can just call out and ask the nurse, tell the nurse that it's beeping, and one of the nurses can just come in here and fix it.
If you are about to begin the vigil of seeing a loved one through a painstaking illness or devastating injury, understand this: you are never alone. Someone is always there to lend an ear or help you get past any emotional difficulties and help you make good decisions. VCU Medical Center's Critical Care Hospital employs on staff social workers who can guide you through the many decisions you have to make on behalf of your loved one. They can connect you with insurance providers, doctors and nurses, home health professionals, and help you find a place to stay. And for assistance in finding deeper meaning or comfort, the Critical Care Unit has a full-time staff chaplain who will be there to assist in prayer, find strength to move on in a time of great weakness, or simply to listen. This holistic approach is designed to make sure both patient and family always have the ability to reach out to someone who can help.
Good job. That's it. Now put your hands up on the walker. At the top.
That includes physical therapists who expedite the recovery process by helping patients take those first steps to good health and independence. And respiratory therapists who work diligently to prevent additional medical problems that can occur in this kind of environment, like pneumonia.
In a critical care unit, the respiratory therapist works with helping the patient's lungs heal. We provide mechanical ventilation when they can't breathe on their own.
Experience teaches us that oftentimes those closest to our patients can find themselves exhausted, emotionally drained, and neglecting their own health. That's because they often feel they must be bedside 24/7. But that is not the best way to care for your loved one.
If you don't take care of you, you are of no use to your loved one that's here. You've got to be taking care of yourself, getting enough rest, enough nutrition to be here for your loved one as things develop and things change for the better, for the worse. whatever. You have to be on your game.
VCU Medical Center offers many dining options and places of relief, so you can gather your thoughts, plan what needs to happen after release from the hospital, or simply take a break. You can even visit the gift shop on the first floor of the critical care hospital for supplies, gifts, or one of those comforting shopping moments. Our waiting areas are filled with light and a great view to help create a comforting atmosphere for friends and relatives.
We have developed a routine during the day now where we'll get up in the morning, we'll call the unit to see what kind of night our son had, finish getting ready, come on in for the morning, spend the day, and we'll take turns in shifts coming back to sit by him, keep him comfortable, talk to him. Even though he's sedated, he hears us, and that's very important. And then at the end of the day, go home, do the daily minutiae that everybody has to do, answer mail, return phone calls, and get a good night's rest, and then start over again the next day.
If you're here from out of town, the Hospital Hospitality House, just a couple of blocks away, offers an inexpensive, comfortable place to stay, never far from where you're needed. Your nurse can give you more information about it. The VCU healthcare system is a teaching hospital. Our doctors are not only some of the most highly trained and experienced doctors in the region, but they are also mentors and teachers. That means your loved one's health care is being provided by a medical team of doctors, residents, nurses, and nurse practitioners. You are in good hands during this difficult time.
The staff here is incredible in the amount of caring that they give not only the patient, but also the family. I have never been told, don't ask that question, or I don't have an answer.
We have one request of you as a family member. Please speak up when you have a question. We want to hear what you have to say. We want to hear your concerns. We want you to feel that the most direct and informative answers are there for you.